name is Pastor David Chuchu. I work with the Evangelical Lutheran Church in Kenya as a pastor, but I also work as the director for Diakonia Compassionate Ministry, which has now given birth to Rehema Open Door. It has been our desire for years to address the need of the people who had no alternative as they move towards the end of their life. They suffer in homes with no care. Even when a time comes that they die without dignity. And therefore, as a pastor and also a minister who minister to these people in homes as they suffer, we came with an inspiration to come up with an hospice that would be able to provide care to those that need critical help. It is possible to go to the doctors, but the cost is very prohibitive and the doctors are few. Yeah. And the facilities are also far apart. Mm-hmm. So you need transport, you need care. So the funny part in our country, anybody working in the hospital is nicknamed a doctor. Oh. Whether it's a patient, whether it's patient attendants, a clinician, or a nurse. So you'll get everybody calls them a doctor. If you need specialized treatment from Homa Bay County, where we have, you have to travel 3 hours to go to Homa Bay to get a doctor. And you go there are a few doctors. You may get 3 doctors. And the line may be may be long. So people would be able to go, but you need the costs. So Kenya adapted more of a preventive approach to medication, where a lot of awareness at community level is undertaken to minimize the people that will be able to see the doctors. Because the community health centers, the in charges are nurses, and they run them. They would prescribe medication, they would give injections, they would deliver babies. So everything that the doctors would do, they will do at that village because of the scarcity of the doctors that would be able to do that. So that's why when we come up with a community intervention that gears towards critically ill patients, I think it has been a very big gap. One was there was a very elderly lady who was abandoned. She was lonely in the house. She was called Elizabeth. This lady could not move. So the neighbors could come and spread a mat for her to sleep. And the evening would put the lady back in her house and light fire so that the house would keep warm. Unfortunately, one night the blanket caught fire and there was nobody to remove the blanket on this lady. So she had a very serious burn beginning from her leg that caught the fire that was as a result of the blanket that there. But nobody was there to take care of her. So the burn resulted into wounds. And there was no care, nobody treated the wounds, and as a result, she died of that. She was almost 80, and she died. The second scenario was what we went through with my mother-in-law. My mother-in-law was diagnosed with brain tumor, and she was operated in Eldoret. And when we visited after 1 month, the entire symptoms that she had before the surgery came back. And we revisited the hospital again, and they told us that she had cancer. It has developed into stage 4, and that would not be able to reverse. So she would rather need to go for chemotherapy for a particular time. And when I consulted further, the doctor advised me that if you could get an hospice that would be able to manage her pain and provide the care from her sufferings, she would probably die a peaceful death. We took the option and we took my mother-in-law at Muhoroni St. Vincent Hospice Care, where she was there for slightly over 6 months. I witnessed how it was and how her pain management was done. And true to the words I was told, whenever we visited her at the hospice, she would sing with us, pray with us, talk with us, without even noticing that she was in pain. And when she wanted to go to her home, St. Vincent would be able to discharge her. So I could drive to the hospital, to the hospice, take her to her home for 2 days or 3, just walk around through a wheelchair, and then return her to the hospice. There being no any other hospice in Homa Bay, Migori, Kisumu, these 4 counties of over 5 million people. I thought what we went through, and many people who have no opportunity to visit the palliative care would benefit a lot. So this was inspiration for my work so that we may be able to establish hospice care. So there are a lot of families that suffer in-house and there is no alternative. You would go to the hospital and the hospital says, this we cannot manage. So we are providing an alternative to that gap that would be able to address those needs. Yes, Rehema is a community project, so that's why we are using the community strategy of community health volunteers to get the word out. So it's more or less of people owned at a community level. So one of the significant things that we will do in our training will be to train people and know when to transfer a patient that is beyond their capacity or ability to handle. And training the community volunteers will give us an opportunity to have a wider reach. We have a goodwill of the entire county of Homa Bay. So in the area where we are, our member of county assembly, Joanne Ogada, is very supportive, and being a nurse herself, has promised also to work with us. We may not get much financial support, but we have the political goodwill. Rehema means mercy. And when we designed our logo, it has an overall heart with a cross and a key that open the door of mercy to those who are suffering. Christ himself suffered and gave himself for us on the cross when he died. Rehema would open for them the gates of being with Christ at the point of their deathbed, at the point of their suffering. So when somebody is undergoing critical and terminal illness, in pain and suffering, we want to bring a message of hope with an open door, a sanctuary where people could enter and get the mercy. We appeal for people to support us with prayers so that you will put whatever Rehema does in Kenya in your prayers. Prayers does wonders behind the doors, and we believe that will be possible. Our partners in the US have also registered a nonprofit called Always Mercy, which partners with Rehema on this end. So if you are able to support us, reach Always Mercy's website. Whatever you reach to Always Mercy will be extending hand to Rehema Open Door in Kenya.